Good morning, everyone. Thank you for being here today. My name is Patrick Ryan. I'm the president of the Professional Ambulance Association of Wisconsin and a co-owner of Ryan Brothers Ambulance here in Madison. I, along with my colleagues behind me, are very pleased to be here today to talk about an initiative between the Attorney General's office and the office of Brad Schimel and the Professional Ambulance Association. This is the whole topic of NARCAN is one that we all know too much about in today's society. And as EMS providers of all types, we struggle with the ability to keep up with the demand for the need for the administration of the drug. And this is a great development that will help us better serve the public communities that we do provide service for. The Professional Ambulance Association of Wisconsin is made up of approximately 40 members of both private, not-for-profit, and fire-based services throughout the state, both urban and rural. And on some level, all of our members are seeing the increased usage and need for the administration of NARCAN. In 2013, approximately 800 Wisconsinites died of drug overdoses, and we can only imagine that this number continues to grow into 2016. So, along with our association and the Attorney General's office, we were able to come up with an initiative which would help provide NARCAN to services, as well as reduce the financial burden on especially small services who need to keep up with the demand for using the drug. So at this time, I would like to recognize and bring the Attorney General Schimel to the podium and thank him for his great work with us.
Well, thank you for being here, and I want to thank members of the media for the continued interest in this story. We are facing a public health crisis in our state. This epidemic is unlike any other drug challenge we've seen in well over a quarter century in our state. And in addition to the over 800 people who died from opiate overdoses in the last measured year, there were thousands of administrations of NARCAN. I know from numbers back in 2012, when we ran ambulance run data combined with self-reporting to the AIDS Resource Council, we had well over 5,000 statewide NARCAN administrations in 2012, and those numbers have been going up and up. And we're at the point now that opiate overdoses are outpacing car crashes. Uh-oh. I didn't even touch it. We're at the point now that opiate overdose deaths are outpacing car crash deaths in our state. And when we look at the last recorded numbers from 2000, or the last gathered numbers from 2013, opiate overdoses were on pace to beat falls as the #1 cause of injury death in our state. We're still waiting for 2014 and 15 numbers, but if the trends continued, we're going to see a new champion, a new #1 cause of death. And so we're taking at DOJ an all-hands-on-deck approach. We are going after this from every angle we can, and one of those is to make NARCAN more easily accessible and more affordable. And unfortunately, there are so many administrations happening now by EMS that it's become a budget issue for the ambulance companies and the fire departments. And so we've been able to negotiate a rebate on NARCAN purchases so that they can at least cover some of the hit that they're taking to their budget from this dramatic increase we've seen. We followed several other states, New York and Ohio, that also reached agreements with Amphastar to accomplish this, and we're hoping that this is just one piece of a much bigger picture, but whenever NARCAN is administered, it's saving a life. And if we faced the thousands of additional deaths, if we didn't have this antidote to an overdose readily available and affordable, we would be in a position that would be just shocking. And frankly, it's shocking now, the number of deaths we're seeing. I know from some of the ambulance personnel that are here, you know, I heard one anecdote from one about how as the snow melted, they're finding people are finding syringes in snowbanks that are melting. I know that the Greenfield Fire Department is represented here, and they've seen a severe problem in their community, and they have stepped up with some really innovative practices there to try to address this problem head on. We're doing everything we can to deal with this. We need every citizen in the state to recognize the role they can play too. We know that 4 out of 5 heroin addicts started by abusing prescription painkillers. We know that 70% of the prescription painkillers that people start using are obtained improperly from friends or family. So we can address a huge part of this problem if people will be careful with prescriptions in their homes, use them only as prescribed to them, store them safely and securely, and dispose of them properly when you're done. We all have a role to play in this, and today we're announcing one piece to hopefully further this cause to bring our state back to being healthy again. We're happy to take any questions you might have.
So how much is this going to lower the price? What is that? It's a $6 rebate, but can you give us some sort of math on maybe how much money that's going to save?
It's about a 25% price reduction, and at this point every bit helps.
And that's $6 per syringe, or are you using the nasal ones now too?
This rebate relates to the syringe that is used by EMTs.
How much effort went into making this negotiation happen?
It wasn't actually that rough. It had several other states had already paved the way on this. We got in and said we want to be part of this too. So there was a modest amount of negotiations with our legal team, but it didn't take all that much effort.
How are the rebates going to work? Do they need to fill out paperwork, or is it an automatic?
Yes, the agencies that are administering the NARCAN will keep track of their administrations. They will turn that over to DOJ. We will submit that for the rebate requests. In all likelihood, given the number of agencies using it, it's going to be a rebate that'll come to DOJ, and then we'll cut checks out to the individual ambulance agencies and fire departments.
This is not just EMT services, but police are now carrying NARCAN in their squads and everything like that. Does it extend to those too?
Law enforcement are carrying the nasal administration, and this is the intravenous or needle injection kind. Takes specialized medical training, and so that's why this is only for EMTs. There is the potential for us to work on also getting a rebate arrangement relating to the nasal NARCAN, and you can imagine we're working on that already.
So we've heard that there's the possibility of naloxone or NARCAN being available over the counter. In some other states it's already possible. What's the forecast for that ever happening in Wisconsin?
We've actually addressed some changes in our legislature already to make that possible, and that is certainly something. I want to make sure we follow the law as we do it, but I have absolutely no objection to that happening in our state, and I know that some pharmacies are in the process of making that happen already. NARCAN doesn't have any abusive qualities to it. There's nothing you can't get high off of it. There's nothing you can use to enjoy it. There are no known harmful effects. So it is really, it has one purpose. It is an antidote for an opiate overdose. It's otherwise inert, except I guess like with anything, if you take enough of something, take enough water and you can poison yourself. But other than that, it doesn't have any harmful impacts.
I'm curious too, there have been some shortages, some issues of getting the NARCAN and the price of it. Did we kind of get into this deal right under the radar? Were we able to lock in on this sweetheart deal before things kind of astronomically went up?
I don't know whether we got in just in time or not. We got in. We've got the rebate arrangement here. We're going to work on that also with the nasal injection form of NARCAN. I think there's a supply and demand element to this, and we're not the only state that's seen such dramatic increases. All 50 states are experiencing the same problem.
Are you in any sort of like contract with Amphastar then, if another pharmaceutical company were to create a a cheaper brand of Narcan, would you be able to switch over?
We're just in a contract relating to rebates, and actually there are other companies that that manufacture or distribute the nasal form. So yeah, there's nothing exclusive about this.
How would you characterize with the recent passage in the legislature of additional opiate laws, how would you characterize where Wisconsin is in the grand scheme of
You know, actually, I'm very proud. In Wisconsin, we're one of the leading states in the nation taking this problem on. At a recent national conference of attorneys general down in New Orleans, the room was polled, and there were representatives from nearly all 50 states. The room was polled, and the representative from Wisconsin was able to raise their hand as to every single initiative that's been explored nationwide. There weren't many other states that could raise their hand as much as to say we're doing those things. I'm very proud of the work our legislature has done, led by Representative Nygren. Unanimous approval of both HOPE legislation packages of bills. I'm really proud of our medical community in Wisconsin. They have stepped up. They've been partners with us in the Dose of Reality campaign. They helped develop the messaging. They've distributed that messaging to their membership, and they're also working hard to change prescribing practices and also to change conversations with patients. And they're doing this through their profession, which will be much more effective than a law change, even if we could do that. We can't mandate what conversations a doctor has with their patients, but the medical community can, and they are doing it.
How sad is it that it's come to this, that we need rebates now on a overdose medication?
It's remarkable that the volume has gotten so huge that it's become a budget issue. This is something that, 10 years ago, I don't think anybody would have imagined that ambulance crews would be administering so much of this that they have to start thinking about whether they can meet their budget at the end of the year. And we're gonna hear this from law enforcement too. We're already hearing some rumblings that it's expensive. They want to have this on their officers so that they can save lives. No one wants to stand there and helplessly watch a person expire while you wait for someone to arrive who can administer the NARCAN. So it is a budget issue, and hopefully we'll be able to strike a deal that can get rebates for that as well.
Will you share with us some of those stories of these ambulance companies across the state telling you about these budget issues and how they would not be able to participate in the program because they simply didn't have the resources to do it, perhaps,
Well,
until now?
yeah, they're here, and that's they reached out to us to express the concern that it is stretching their budget. There's one thing I want to say too, and it's not in response to your question, but one of the other things in talking to law enforcement and EMS from around the state, people think that this is an inner city problem, that this is just the bad kids. Well, these people behind me respond to an awful lot of nice houses. They respond to an awful lot to tragedies in the homes of a lot of really good families. They're bringing back to life, and sometimes not able to get there fast enough as well. But they are addressing overdoses of people from all walks of life, people with all different, across the whole spectrum of life experiences and demographics. This is affecting everybody. And anybody who thinks this can't touch their family, their community, their school district is mistaken. It can.
So when they came to you, were you surprised in any way that this was happening, that they could not afford to make this happen?
It hadn't initially occurred to me to seek the rebates. It just hadn't occurred to me that this was starting to become that much of a budget impact. But I've known for years that there is a huge volume of administrations of NARCAN that's been going on for years already. Again, thank you very much. We could not press this story out if the media didn't help distribute this story, and we're grateful to the media for all your involvement in keeping on telling this story until every household in this state understands that we are in the middle of a public health epidemic, and we all have to play our part to get our state back to healthy again. Thank you very much.